Drugs and their applications. Drugs are chemicals of lower molecular mass, that is 100 to 500 unified mass. These interact with macromolecular targets and produce a biological response. When the biological response is therapeutic and useful, these chemicals are called medicines and are used in diagnosis, prevention, and treatment of diseases. Most of the drugs used as medicines are potential poisons if taken in doses higher than those recommended. Use of chemicals for therapeutic effect is called chemotherapy. Classification of drugs. Drugs can be classified mainly on criteria outlined as follows. On the basis of pharmacological effect, this classification is based on pharmacological effect of the drugs. It is useful for doctors because it provides them the whole range of drugs available for the treatment of a particular type of problem. For example, analgesics have pain-killing effects. Antiseptics kill or arrest the growth of microorganisms. On the basis of drug action, it is based on the action of a drug on a particular biochemical process. For example, all antihistamines inhibit the action of the compound histamine A, which causes inflammation in the body. There are various ways in which actions of histamines can be blocked. On the basis of chemical structure, it is based on the chemical structure of the drug. Drugs classified in this way share common structural features and often have similar pharmacological activity. For example, sulfonamides have common structural features given below. So this is the sulfonamides. Then on the basis of molecular targets, drugs usually interact with biomolecules such as carbohydrates, lipids, proteins, and nucleic acids. These are called target molecules or drugs or drug targets. Drug possessing some common structural features may have the same mechanism of action on targets. Thus, the classification based on molecular targets is the most useful classification for medicinal chemists. Then, drug target interaction. Macromolecules of biological origin perform various functions in the body. For example, proteins which perform the role of biological catalyst in the body are called enzymes. Those which are crucial to communication system in the body are called receptors. Carrier proteins carry polar molecules across the cell membrane. Nucleic acids have coded genetic information for the cell. Lipids and carbohydrates are structural parts of the cell membrane. We shall explain the drug target interaction with the example of enzymes and receptors. Enzymes as drug targets. Catalytic action of enzymes. For understanding the interaction between drug and enzyme, it is important to know how do enzymes catalyze the reactions. So in their catalytic activity, enzymes perform two major functions. The first function of the enzyme is to hold the substrate for a chemical reaction. Active sites of enzymes hold the substrate molecule in a suitable position so that it can be attacked by the reagent effectively. Substrates bind to the active sites of the enzyme through a variety of interactions such as ionic bonding, hydrogen bonding, van der Waals interactions, or dipole-dipole interactions. So this is the active site of the enzyme. This is the substrate which is going to attack, so it fits into this active site. So enzyme holding substrate. The second function of the enzyme is to provide functional groups that will attack the substrate and carry out chemical reactions, right? So there is a particular specific functional groups in this and functional groups in this substrate which will have the reaction, which will do some reactions. Then drug enzyme interaction. Drug inhibit any of the above mentioned activities of the enzymes. These can block the binding site of the enzyme and prevent the binding of substrate, or can inhibit the catalytic activity of the enzyme. Such drugs are called enzyme inhibitors. Drug inhibit the attachment of substrate on active sites of enzyme in two different ways. Drugs compete with the natural substrate for their attachment on the active sites of the enzymes. Such drugs are called competitive inhibitors, right? So these are the drugs. So instead of substrate, these drugs fit into this enzyme active site. So So this is the drug and substrate competing for active sites of the enzyme. So drugs block the active site of the enzyme. Enzyme then is the active sites. This is the allosteric site, right? So inhibitor occupying the allosteric site, active site with change shape. Some drugs do not bind to the enzyme's active site. These bind to a different site of enzyme which is called allosteric site. This binding of inhibitor at the allosteric site changes the shape of the active site in such a way that substrate cannot recognize it. So sometimes these inhibitors or these drugs do not attach here, and it gets attached here to the active site, and it changes the shape. And if once the shape is changed, so it could not react with the substrate. If the bond formed between the enzyme and inhibitor is a strong covalent bond and cannot be broken easily, then the enzyme is blocked permanently. The body then degrades the enzyme inhibitor complex and synthesizes the new enzymes. Then is the receptors as drug targets. So receptors are proteins that are crucial to body's communication process. Majority of these are embedded in cell membranes. Receptors proteins are embedded in the cell membranes in such a way that their small part possessing active site projects out of the surface of the membrane and opens on the outside region of the cell membrane. Suppose this is the site, so this is the binding site of receptor outer surface of the membrane. This is the receptor protein is there interior of the cell and the inner surface of this cell membrane. So in the body, message between two neurons and that between neurons to muscles is communicated through certain chemicals. These chemicals known as chemical messengers are received at the binding site of the receptor proteins. To accommodate a messenger, shape of the receptor site changes. This brings about the transfer message into cell. Thus chemical messenger gives message to the cell without entering the cell. So these are the chemical messengers. So it joins here at the binding site. So receptor receiving the chemical messenger, shape of the receptor change after attachment of the messenger, and receptor regain structure after removal of the chemical messenger. There are large number of different receptors in the body that interact with different chemical messengers. These receptors show selectivity for one chemical messenger over the other because their binding sites are different shape, structure, and amino acids composition. Drugs that bind to the receptor site and inhibit its natural function are called antagonists. These are useful when blocking of message is required. There are other types of drugs that mimic the natural messenger by switching on the receptors. These are called agonists. These are useful when there is a lack of natural chemical messengers. So this is important. Then next is the therapeutic action of different classes of drugs. In this section we shall discuss the therapeutic action of few important classes of drugs. Antacids. Overproduction of acids in the stomach causes irritation and pain. So this is the overproduction of acid in the stomach causes irritation and pain. So in severe cases, ulcers are developed in the stomach. Until 1970, the only treatment for acidity was administration of antacids such as sodium hydrogen carbonate or a mixture of aluminum or magnesium hydroxide. However, excessive hydrogen carbonate can make the stomach alkaline and trigger the production of even more acids. Metal hydroxides are better alternatives because of being insoluble. These do not increase the pH above neutrality. These treatments control the only symptoms and not the cause. Therefore, with these metal salts, the patient cannot be treated easily. In the advanced stage, ulcer becomes life-threatening, and its only treatment is the removal of the affected part of the stomach. A major breakthrough in the treatment of hyperacidity came through the discovery according to which a chemical histamine stimulates the secretion of pepsin and hydrochloric acid in the stomach. The drug cimetidine tagamet was designed to prevent the interaction of histamine with the receptors present in the stomach walls. This resulted in the release of lesser amount of acid. The importance of a drug was so much that it remained the largest selling drug in the world until another drug, ranitidine Zantac, was discovered. So this is the histamine, this is the cimetidine, and this is the ranitidine. Antihistamine. Histamine is a potent vasodilator. It does various functions. It contracts the smooth muscles in the bronchi and the gut and relaxes other muscles, such as those in the walls of the fine blood vessels. Histamine is also responsible for the nasal congestion associated with common cold and allergic response to pollen. Synthetic drugs, bromophenramine, dimetapp, and terfenadine, saladin, acts as antihistamine. They interfere with the natural action of the histamine by competing with histamine for binding sites of receptors where histamine exerts its effect. So this is the structure of bromophenramine, dimetapp, and dimetane, and this is the structure of terfenadine, that is the saladin. Now the question that arises, why do above mentioned antihistamines not affect the secretion of acid in stomach? The reason is that anti-allergic and anti-acid drugs work on different receptors.